Press the bell icon on the YouTube app to never miss a video from Newslaundry.
Hello and welcome to Newsroom webinar in partnership with the Committee to Protect Journalists. Journalists in India and of course across the world are faced with one of the biggest stories of our lifetime, which is the coronavirus pandemic. This requires us to be on the ground to report on it. But what's unique about this story is also that this puts journalists, exposes them to considerable risks. We've already had a number of cases across the world where journalists have tested positive. And of course, this is one of the professions that's not being talked about much, but it also entails high exposure. So we have with us the Committee to Protect Journalists, two members from the London security team, Colin Pereira and David Oades. Welcome, Colin and David. Thank you for being part of this. Both of them are journalist safety consultants. Colin is a journalist safety consultant and David is a journalist safety advisor at the CPJ security team based out of London. They're going to run us through a short presentation on safety, some important things that we should be keeping in mind, a toolkit that they have. So without wasting much time, I'm going to get them to present this to us. And then we have a team of wonderful journalists with us that I'll introduce later. And we'll get into a quick conversation on safety for journalists. Colin and David, go ahead.
Thank you very much, Manisha. So I'm Colin Pereira. As Manisha says, we work for the Committee to Protect Journalists. And our background is, although we are the safety consultants for the Committee to Protect Journalists, we also advise 14 different newsrooms around the world on a daily basis about their general safety and security. So in the last few weeks, since the break of the story in Wuhan, we've been working with news teams covering COVID-19 in China and around the world in Italy, USA, UK, Europe, everywhere really, and increasingly in Africa and South Asia. So my background is I have been doing this for about nearly 2 decades. This is the 4th epidemic I've covered, including bird flu, H1N1, and Ebola. I've covered several Ebola outbreaks, and now this COVID-19, which I have to say is the most serious pandemic that I've had to cover. I'll let David introduce himself.
Hi, everybody. So I'm David at CPJ with Colin. I also work with Colin at HP Risk Management. So my background's more from an adventure travel background, but I came into the media industry last year. I was quite heavily involved with the Ebola outbreak in West Africa back in 2014-15. And with the current COVID situation, I've been largely writing the safety advisory for the CPJ with oversight from Colin and additional information, and will be assisting with future updates to the advisory, of which one should be coming out next week. So just keep your eyes peeled for that.
So as David alludes, at the CPJ, we're part of the team called the Emergencies Team. And we deal with breaking news stories and any sort of difficulties that journalists might find themselves facing around the world. And so we have been putting out a regular safety advisory on the CPJ website, which is www.cpj.org. And it basically outlines best practice on how to cover this story. As Manisha was saying, a number of journalists have contracted COVID-19, and unfortunately, a small number have already passed away. I know of 2 journalists in Spain and 1 in America who have already died of this disease. So it's quite serious. And I'm just going to do a quick presentation unless anyone's got any questions.
These were the journalists who passed away. They were television journalists or print journalists. Or...
I know the journalist in America was an NBC journalist. I don't know if he was on TV. I think he was behind the camera. And okay. I think the 2 Spanish journalists were also on TV, but I would have to look that up. I'm not 100% sure.
Okay, I was just curious.
For reporters in India who are going to cover this story, the first thing to work out is, are you in the high risk category? Do you have an underlying health condition like diabetes, or does someone in your home have an underlying health condition like diabetes? Because if you go out and you're working in informal settlements and slums and you're coming into close contact with people and you get infected and you come back and you infect your loved ones who have these underlying health conditions or are old, you can possibly kill them. right? And that's what you need to realize, is you are bringing this disease back into your home, and your kids and your wife or your husband and your family members will be infected by you if you don't observe correct practices. And even if you observe the correct practices, the chance of getting infected is very high, right? So you need to think about that, because it's great for your editor to say on the news desk, go down there and cover this train station that's full of people going home. But you need to think in advance, should I be saying, send someone else? And it's easy for me to say that sitting in London, because obviously you guys are in a different financial situation with your bosses when they're saying, go and do this. And you're saying, well, I have a problem at home. And they're going, well, I'm letting go of staff. If you can't work with me, I have a problem with you. So these are all discussions that you need to have with your bosses. And you also need to figure out if you need to self-isolate. So if you go to a hospital or a high-risk location and you get infected, are you going to go home and expose yourself to your family, or are you going to be able to stay away from them? Are you able to stay in your house in a room separate from them? How are you going to manage that situation? And it might be that you can't, but you need to think of all of this. And if you are self-isolating, how are you going to get supplies, food, all of this kind of thing you have to think about. Now, I know you guys are in lockdown. I'm not entirely sure. Are reporters still allowed to go out and about?
Yeah, a lot of, I think a lot of digital media organizations have started work from home. Dhanya, with your organization, are your reporters going out?
See, there were press conferences happening till a few days ago. So we were forced to go for that because there's no other way that you can ask questions, because most officials have stopped picking calls. The reporting, I think I have a doctor in my team, a medical doctor. So she is the one who goes to hospitals if there's any reporting, because she understands basic hygiene and how to be careful more than the others in the team. There are a couple of people who have gone for reporting here and there, but thing is, the reporters are also young and they want to be on the front lines. But I keep insisting that have your gloves, have your mask, stuff like that. I mean, there's definitely been very less on-ground reporting, I feel, because we just can't afford to people everywhere for on-ground reporting, but there is minimal on-ground reporting happening.
I think television guys are the ones who are really still out and about. Digital news operations have largely tried to do work from home and work on the internet or make calls. And yeah, some of newspaper people
TV
also. TV, I'm seeing a lot of TV guys still
every day.
At bus stations, at the railway stations, at hospitals, at hotspots.
A lot depends on the news organizations and the resources they have to protect journalists. If they don't have taxis to give to journalists, if they don't have all of that, then not doing it. So mostly the bigger ones that have all the resources.
Okay, so I mean, each country is different and each news organization is different. But I tell you what, every news organization I've gone to at the start of this has said, oh, we can't work from home. We have to go into the office. And when the lockdowns have happened, they have had to work from home and they've had to change their minds. And, and the denial of saying, we won't do that has sunk into them because governments have forced them to do that. Right? Because journalists can be vectors for this disease. So there's no point in reporting on, society and the spread of this disease and how irresponsible people are being if journalists are being irresponsible. And quite frankly, the more people who work from home, the better. So newsrooms need to start thinking like that. Right? And we are working with skeleton crews in Europe and America and pretty much all the developed world. So if we can do it, so can Indian teams, quite frankly. But again, I think I'm going to come back to the context of India a bit later about working from home and whether you need to adopt the same practices as us. But like I say, every newsroom in the world is resisting it, and everyone's saying, we are so important. We need to be different. We need to go out there. We are essential workers. And governments are responding saying, some of you are essential workers. Most of you, just sit around the coffee machine chatting and gossiping and spreading the disease. So a lot of people need to actually take a long, hard look at themselves, identify if they are vulnerable or have vulnerable people at home, and identify if they are actually producing crucial news for the country at this particular time. And the other thing about, you said young people going out. Young people are fine, go out. But if you're coming home and infecting your grandmother, you are causing a problem for the Indian state, right? Because one of the key factors in this is the case fatality rate. Out of the numbers of people who are being infected, which are huge numbers, 10% are going to have to be hospitalized, right? So that is what's freaking out nations into reacting. So if you have 1,000 people infected, 100 people have to go to hospital. If you have 10,000, that's 1,000 people. If you have 100,000, that's 10,000. How many hospital beds does India have available to people, to the poor? So the reason why Britain changed its mind about its approach is because someone did a very simple sum when they said 10% are going to go to hospital. If we have 100,000 cases, we will have 10,000 people in hospital. We have 4,000 beds available to them. That means we have a 6,000 bed shortage, and people will be dying outside the hospital just like they are in Italy. And unfortunately for, I think, the media in other parts of the world, is we did not do the maths early enough and show this to our audience, because that is the problem. It's, people will become infected, and what we're trying to do is this famous phrase of flattening the curve. We're flattening the curve to buy our healthcare systems more time, to allow them to buy more personal protective equipment, to allow them to create greater capacity in the number of beds so that they can deal with that 6,000 shortfall. Or if it's 1 million people, that's 100,000 cases in hospitals. How do our healthcare systems cope with that? And that is the debate that is playing out in the media and in politicians' private rooms and whatever. And I don't think in the West we did a good enough job of reporting on that. So I've jumped ahead because I should be talking about how your best practices. But that's what you've got to understand when you're behaving irresponsibly by just going out and interviewing people. Because basically, if you get infected, you're causing the country a problem, right? That's the way to look at it. So take it seriously, because it's not just the normal flu. If you are reporting and you are going to a high-risk location, so that is a hospital, a place where old people live, a place where someone is sick with the disease, or if you are interviewing healthcare workers who are exposed to people with the disease, and that's probably majority of them, or you are interviewing sick people. And I would say in the Indian context, if you are going into slums or informal settlements or places where people live very, very close, cheek by jowl to each other, I would say these are high-risk locations. And in the West, big newsrooms and matured newsrooms are saying, do not do these things, right? Just don't expose yourself to this risk because you will become infected. And they're thinking about it also from a business continuity perspective, because when your workforce is getting sick repeatedly, how do you then continue to cover the news when you've got 25% of your newsroom in bed, right? So it's not just about the infection, it's also about business continuity. And so big newsrooms are saying, do not go in to do this just without thinking about it. And there are certain teams who do this, just like I think it was Neha who said that you have a doctor on your team who's going to do this.
No, I said she did once or twice. She's not doing it any longer.
So if you are going to do that, if you're going to expose yourself to that level of risk, make sure it's people who understand the risk. They don't have vulnerable people at home. They are not vulnerable themselves. And probably they're in the right age group, and they probably should be living alone, right? Because if they do get sick, you don't want to infect other people. And so pick the staff that you're sending, essentially. And don't send your entire newsroom to do this, these high-risk activities, which I'm sure all of you are doing already.
Yes.
And what you've got to emphasize is the need to maintain that distance. So having the equipment and the masks and the gloves and the hand sanitizer is not enough, right, to guarantee infection. Putting on the PPE, the personal protective equipment, is a long and difficult process. Taking it off is even harder, because when you take it off, that's when you probably will infect yourself. Because if you've gone into a hospital and people have coughed onto your overalls or your gloves or something, or you touched a surface, when you're taking off your gloves, that's when you'll be infected, probably, if you're not doing it correctly. And so if you think that wearing a mask and gloves is going to protect you from infection, you're wrong. Okay, what protects you from infection is the distancing. And basically, you really need to observe it. And I don't know in an Indian context if you are able to observe it, quite frankly. So you need to work on the assumption that you will become infected. Now, what we're seeing in various places, and I think this is in India as well, is make sure that outsiders are welcomed into the community. David and I spent the weekend working with a foreign journalist who's trapped in India, and the community that she was in, I wouldn't say attacked her, but they're incredibly hostile to her because she's a foreigner. And she's kind of stuck there now, actually. So even as Indians, if you're going into a community, well, as this disease ramps up, if you are an outsider, they might see you as potentially bringing the infection to them. And you potentially are, right? So they're not wrong. And they might react very aggressively towards you. And certainly in China, this is what you saw in little villages that barricaded themselves in Wuhan and Hubei. They didn't want foreigners to come in. They didn't want outsiders to be in their villages. And you might see that. I would say if you can get a flu vaccination now, which they're in short supply, definitely get it if you don't have it already, and make sure that you have all your vaccinations up to date if that's appropriate. But the other thing is, don't go out and report if you're already sick, right? This is really crucial. If you have some other disease, don't start reporting on this, because it makes you more vulnerable to infection, and it makes you more vulnerable to having a more serious case of COVID-19. So if your immune system is compromised in some way because it's fighting off another disease, you will have a hard time fighting off COVID. And like I keep saying, I say it again and again, maintain that distance of 2 to 3 meters, because that's your best protection. You should avoid public transport, because this is where you're going to get infected. And someone said, oh, newsrooms that can't afford taxis, it's tough. You need to start thinking about, am I going to infect my staff? And if you can't afford to do it right, don't do it. Right? Don't send people on trains where they're overcrowded, or buses or whatever, because basically they're going to get infected. And you're exposing your staff to that. So I know this is really difficult to hear, but I've had this conversation with every newsroom around the world. And Indian newsrooms are no different. Every newsroom in the world has economic difficulties, right? So, you really need to think about your staff and what you're exposing to them to, and their loved ones, basically. It's a good idea to, if you're driving your own vehicle or you've got a dedicated driver, sanitize the vehicle, particularly if you've got carpools afterwards. And make sure you're wearing masks too, because if you are sick, what the masks protect you from is they catch a lot of the, if you're sneezing, they don't necessarily protect you from others, but they catch a lot of you spreading the disease. The other thing is, if you're a TV journalist, don't use flip mics. Use directional mics, and take off the fuzzy muff cover, because that can catch sputum. It's a good idea to wash your clothes every day in very hot water, because this virus can live on your clothes. So if you're going home and you're wearing your clothes and you go into your house, it's a good idea to take off your clothes, get changed as you walk into the house, right? And then wash the clothes every day. So have an outdoor set of clothes and an indoor set of clothes. And again, if you are going to wear protective equipment in a high risk location, make sure you know how to put it on properly, know how to take it off properly, and ideally have medical supervision when you are doing it, because it's really easy to get it wrong. because the thing about this equipment is it's really hot, okay? And you start to sweat in this equipment. And when it comes to take it off, you want to take it off quickly. And also when you sweat, you want to touch your face, right? Because you've got sweat dripping into your eyes. So if you touch your face when you're wearing the equipment, you're likely to infect yourself. So these are all things that are quite difficult to do. And it's easy to think you're protected when you're wearing the equipment, and actually it's making you more vulnerable because you're doing things that you wouldn't normally do, like touching your face a lot more than you would normally do. The best possible protection you can have is washing your hands with soap and water, right? And just do it regularly. Now, this is difficult for journalists who are on low incomes and don't have access to soap and water, quite frankly, or communities that don't have access to soap and water. But it's important that you invest in this stuff because it's not that expensive and it's your best protection. It's better protection than wearing expensive PPE. If you can't get it, if you're out and about, antibacterial gels with a 70% alcohol content are useful protection as well. But bear in mind, in the West, there are now a lot of fake gels and products that they're saying have 70%, and they might not be real. So just bear that in mind. And it's important, if you're carrying camera equipment, to wipe it down with alcoholic wipes that have a 70% content, right? Your camera equipment can carry this disease. So, you know, if you share camera equipment or you share any sort of equipment in your office and you're passing it to other colleagues, you might be passing on the disease. And, you know, so it's good practice to clean it down after every time that you go out or every time you're leaving a location. And it's also good practice to leave a lot of things at home that you would normally have. And bear in mind that, like, your phone is probably going to be the primary vector of disease, because everyone's got one. They take it out, they hold it in their hands, you know, they cough on it if they've got it. If they hand it on to someone else, they will get that disease. So bear that in mind, that you can, you know, you can pass it on if you're sharing phones, but you need to clean your phone regularly. And there are lots of videos on YouTube about how to clean your phone with soap and water. And if you share an office and your hot desk, you need to clean down your hot desk. You need to wipe the computer. You need to wipe the phone down with alcoholic wipes, because the person who sat there before you might have the disease and might be infecting you. And one of the things they think with doctors, right, there's a high rate of infection amongst medical professionals, is because doctors are wearing all this PPE when they're seeing patients and they're being ultra careful, but they're doing long shifts, right? And when they come off their shift, they're going to the common room and they're having a cup of tea with their colleagues. And one colleague has COVID and they're infecting the other colleagues because they're not wearing PPE when they're talking to each other. And they're not practicing social distancing when they're talking to each other because they're tired, right? It's totally understandable. So they think doctors are actually infecting each other rather than to a higher degree than when they're getting it from the patients. Right? Now, this is anecdotal. We don't know if it's true. But, you know, in China, what the Chinese healthcare service was saying to the medical practitioners is that you're not getting it from the patients, you're getting it from your families when you go home. All right. So I don't know if that's true or not, but it's a useful thing for journalists to remember, I think. One last thing, if you're wearing PPE and you're wearing full personal protective equipment, that's PPE, you can't go to the toilet, right, when you're wearing this without, right? So you have to, if you're doing a long camera shoot in a hospital, you can't go to the toilet at any point until you finish your shoot. So lots of people who, you know, the normal advice is hydrate, 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 which is good for your health. And, you know, people are saying it helps you fight off COVID, but you can't go to the toilet because you have to desanitize when you take off this kit. So, you know, in most countries, doctors are doing like 2-3 hours shift, but in, you know, where there's not capacity, if they're doing 9 hours, they're just not drinking before they go on shift. So just bear that in mind. If you do start showing symptoms of the disease, you need to isolate and you need to talk to your doctor about what you should be doing. You should probably do this in advance, right? Now, here in the West, the medical practitioners are so overwhelmed that they don't even want to hear from you. they don't want you to come in unless you're dying to the hospitals. So you should work out in India and in your locality what your hospital expects you to do if you are sick, and how you should present. Don't just get in a taxi or tuk-tuk and drive to the hospital, because you are infecting the driver, right, of that tuk-tuk, who's going to go home to his family and infect his family, right? So hopefully if you are infected, you don't get a very serious case, and that you can isolate for 14 days and as a precaution, and then you won't pass on the infection to others. So these are all things you need to work out in advance, and this is the messaging you need to pass on to your audiences, quite frankly.
Great.
So in an Indian context, I've already delved into the the social distancing issue, or the physical distancing issue. What does it mean to Indians? And I mean, you're better placed to tell me what it means to Indians. I don't know, but I don't think it's possible, quite frankly.
Yeah, I think there was a Times of India report that said that an average household is about 5 members, and about only 5% of Indian households have more than 5 rooms. So, which means that most Indians are sharing rooms. And I think those of us who can actually self-isolate are really privileged. But most people, most families, we share rooms, communities share toilets, entire like localities and slums share, have a communal toilet set up. So I do think social distancing is really, it's not something that everyone can practice. So I'm going to quickly introduce the journalists that are with us. We have Dhanya from the News Minute. We have Paujel from Imphal Free Press. Shailesh from 101 Reporters, that runs a network of freelance reporters. And Chaitanya from Mumbai Mirror. And Neha Dixit, who's an independent freelance journalist. So I just want you guys to actually jump in if you have any questions. I have a few, but I'd like you guys to go first. So anyone who'd like to, any queries or any points that you'd like to make?
So I get the spirit that we should not be sending reporters outside, and we have been trying to do that maximum. But for example, today we were reporting a story on what is happening in slums in Bangalore. The government is announcing free ration and rice, but it's just not reaching people. And today they've said they're banning 2-wheelers and 4-wheelers, which is basically people can't even take their bikes out to go get food. How do we report that without going there is the first thing. So, no, and then as an editor, I'm then confused whether I should be telling one person to go and tell the other person to not go. I'm very confused as to what to do.
Okay. So I would have a conversation with your staff and work out who is vulnerable, as in who is in the high-risk category, or who has vulnerable people at home. Those individuals should be disqualified from going to high-risk locations like a slum, right? So they should be doing telephone interviews and essentially working from home, right? Any sort of remote work that they can do.
What if a high-risk person still wants to go and I tell that person not to go?
Well, if you're the editor, they should be doing what they're told, right?
But I don't know, I'm not able to stop certain journalists. They are under risk, like high risk. I don't want to say what, but I just can't. They're like, no, but we have to report this. We have to go. And they're all about 30. It's not like they don't understand. They're not like 21, 22-year-olds who've just passed out of college.
I think one thing, the problem is that, and I think this is probably one of the problems with the kind of media that we're consuming also, like Colin said, the comparison to flu. A lot of people still think it's like the flu. I think a lot of us just don't understand, even in terms of, forget the fatality rate, but even the symptoms, it can be really virulent for some people. It can really take over. You could have like terrible bouts of breathlessness and terrible body ache, and it could be real. I think one of the reasons why I guess even journalists are not understanding what this could do is we're just not taking how serious it could be once you contract it. And I think one of the very effective tweets that I personally found was, I think, from this American doctor who put out a little Twitter image of how far the swab has to go into your nasal cavity to do the test. And she put out a little picture and it showed that it really like goes up your nose. So, I mean, even the test is really painful. So I think, And she said that you're probably better staying at home because even the test it's not just a prick or, just a. So I don't know. I think maybe we should really talk about the symptoms more without maybe scaring people off, but still emphasizing that it's not a sneeze or a cough.
I just wanted to add to what Dhanya said and Colin had said earlier, that when news organizations in the West can do it, why are we not doing it? I just wanted to say also, when it comes to work from home, and this has been an age-old debate, and in countries like ours, in the developing world, accessing data, accessing information is far more difficult. Sometimes the only way you can, like Dhanya said, the only way you can get information is when you land up at a government office, and when the government sees you is when you get information. And that way it becomes all the more difficult. And also I want to point out, because a lot of mainstream organizations in India have shut down their state bureaus, and which is why they're very largely dependent on local journalists who have no safety gear and who have to go out and do it. Once we ask them to stop, the only kind of news reporting that is coming is from the metropolitan cities or the state capitals. We don't know what's happening in the back of the beyond, which is the most vulnerable population on the margins. So it becomes extremely a difficult question how to, not go out or not let people go out and see what's happening. So it's going to be a challenge. So Corona, of course, is a big threat, but what is also going to happen is, for a long time we will not know what happened in the remotest corners of this country and how people died. And because this government especially is not particularly reliable when it comes to information and data, and with the yesterday's Supreme Court order, it's going to be more and more difficult for this country, this democracy, and the kind of information that should come out to people.
So look, I'm delving away from my sort of safety brief, but the thing about this disease, right, and the way governments are reacting, is there are going to be hidden social costs to the way the governments have reacted that we're not talking about as the media. And it may be that the intrusion, certainly in the West, the intrusion of privacy as they use data to track the disease is not worth the cost of our democracy. It's basically undermining our democratic rights. And are we going to be unable to unravel this afterwards? We don't know, right? So a lot of things happen in wartime, which they are comparing this to, that are not necessarily good for the country long term, right? And those are very valid debates. And I think in the Indian context, a lockdown in a country where people are struggling to feed themselves, there's no point in saving yourself from COVID if you've died of hunger, right? So I think there are very valid discussions to have, and I'm not saying do not go out and cover these stories, but I'm saying as editors in charge of people, you need to tell your most vulnerable not to do that. If they choose to go and be reckless and irresponsible with their own lives and the lives of their loved ones, that is their choice. But you can say with a clear conscience, we told them not to do these things, right? If you tell them not to do these things, it means you can't take their content when they produce it. You've got to say, I'm not accepting that, okay? Because that's an ethical thing. There's no point in telling someone to, there's no point in telling them, don't do that. And if you come back with something great, I'll buy it. I'll take it from you, right? So that's on you. That's your own moral decision, okay? And it might be that in the Indian context, you decide that the risk to their lives or the risk to the lives of your staff is worth it, because the story is so important to India that you need to tell that story. But I tell you what, every single war zone that I work in, that's what every single journalist says to me. This is so important, I need to risk my life, right? When I speak to their families after they've died and I'm trying to help them out, no one ever says that to me. No one ever says, oh, I'm so grateful my husband died because he got the story out there, or my wife died, right? So you will have to pick up the pieces of your staff dying if you've been buying their content, if you've been sanctioning what they're doing, right? You will have to carry that with you for the rest of life. So make sure it's worth it.
Chaitanya and Paujel, would you like to come in? Chaitanya, since you're working with the daily, and I'm guessing that involves a lot of hitting the ground, and you're also in Maharashtra, which is one of the hotbeds right now.
Yeah, no, for as far as data is concerned, we've been a tad lucky because data is easily available in terms of the number of cases. The only issue we are having is that when we report on clusters now, as you see in the Mumbai metropolitan region, we've had about 190 cases. And the number of cases, they started with the high rises and they have moved to slum areas. So, I mean, if you want to report anything from a slum, it's physically impossible to report it from the outside. So if you have to report, you have to go into the bylanes, and only then can you understand, how the virus is spreading. And what they've done here right now is they have created a lot of containment zones where entire pockets of slums have been completely sealed. So then, in that sense, physical reporting has become difficult. But as far as data is concerned, there's a morning and evening briefing where we are getting all the numbers from across the state. And I think we've got we have tested about 6,000 samples so far. So in that sense, that kind of data is easily available.
I think most journalists in all states should really insist on this, because some states are not doing this, but like a lot of your job on ground reporting is eased if you have the government talking about the numbers, talking about what they are seeing. I think today Kejriwal also said, he gave out numbers on how many people were on the ventilator versus how many people. So I think if as a community also journalists could insist on state governments being more responsive, it would really help ease out some of the ground reporting. What are the sort of issues you're seeing, Paujel? We haven't heard much from Manipur, at least in Delhi. Even if you do here, it's a tiny box item. But how's the situation there? And have you guys been, are journalists aware there yet about what this disease is all about? Are they practicing all the safety norms?
The first case of COVID-19 was on the 23rd of this month in Manipur. So what happened is the lady, she came from UK and she was positive on the 23rd. She came on 21st. So the entire lockdown started in Manipur, not from 21st, but from the 20th of March, one day prior to the national lockdown.
Okay.
Because that was all by civil organizations demanding something. So at least one day ahead. But from my personal experience, the All Manipur Working Journalists Union, from some of our advisories, have given a prior commitment to the state that the work of the media will not stop. What is the duty of the media? We're here to inform. We're here to pass information. We're here to debate and see that the fact is carried to the public. And we have to sensitize the public on all these matters. As Colin was saying, if we do not inform, but we're in a devil and a deep blue sea situation. For example, I am supposed to go to the ground zero and I'm supposed to report. And my better senses and the precautionary measures are telling me not to go there. Let me explain in my situation. The first COVID patient was almost my neighbor in our lane. She was from our lane. So the first time I heard the news was I woke up in the morning and it was confirmed. Fine. Then what happened is I got a little bit scared also. Fine. I'll say that I was scared. But being a journalist, you want to see what's happening. That it gets to you, that itching. So it gets to you and you break everything. You see the next day I went out there and I took a video. I went to the bylanes and I interviewed some people over there in the first hotspot. So the first person whom I interviewed turned out to be the neighbor of the lady who was positive. So I was in the hotspot area. This is my area. Now, when I came back home, the thought came to me like, see, I may be doing my job. But I come from a part of the state where there has been a lot of civil unrest and a lot of law and order problem disturbance, the Armed Forces Special Power Act, and we are not new to danger. We have taken a lot of things. We have been there, done that in some ways. But what is very, very different about this situation is that I can take that hazard it is a professional hazard. If I get shot, if I get kidnapped, if I get murdered or like in an accident or whatnot, I am ready to accept it. But in this situation, I am not endangering myself, but as Collins pointed out, my family. Here I have asthmatic children, I have my parents. All right, fine. If I get infected with COVID, I'll take it as a personal hazard. But if I become this, the carrier to my family, who is under lockdown, so what do I do? Now I am in a very big dilemma, but I have been in quarantine for like the past 7 days in my room. But I do go out a little bit here and there to see if everything is all right. But I'm keeping my fingers crossed. I have some dry cough, but as all the other things are there, I am hoping that it's not that coronavirus. I don't want my family to be affected, but I need to carry the news. I need to bear the thoughts that we have to be very extremely careful in these times of duress, when the government inability is there, and what sort of things are the state capable of. The health infrastructure is at the lowest thing, and it is like a tsunami, a tidal wave suddenly coming up to us in India.
And I think that, yeah, one of the things, again, like, it's very important that you point out that it's just not you as a journalist could sign up to the risk, but your family has not signed up for it, your friends have not signed up for it, and you can't be a carrier in this case. And I just wanted to come to, Shailesh, and just wanted to address, now a lot of the journalists with organizations have a sort of backing when it comes to medical help or even guidance. You are running an organization with freelance journalists, and freelance journalists, I think, often find themselves really vulnerable here because you don't have sometimes enough guidance, you don't have organizational support. So are there any specific concerns that your network of journalists have that we could address through this, Shailesh?
Yeah, so
is a specific concern for journalists who are not affiliated with organizations?
Yes, the biggest concern what most of my freelance reporters have expressed is one is the lack of ID cards. When the entire media industry is going out and able to go out at least with the media cards, all these journalists who want to cover the story, they don't have the press cards, and that's when they have to deal with the cops, and the cops are like in a completely different mindset right now. The moment they see people on the roads, all they want to do is send them home. Fortunately, some police teams have been very polite, but others have been completely brutal. A couple of my reporters got almost bashed up by the cops. So that is the biggest problem my reporters convey. The second thing is the lack of information in the journalist community. We all know that we have to wash our hands, we have to keep distance, but the lack of information is there in terms of symptoms. When do you know that these are the symptoms? Like right now, in the present condition, India is facing the weather change, and a lot of viral fever goes on at this time. So a lot of people are experiencing mild fever, a little cough, but they know that there are three things: the dry cough, the breathing difficulty, the fever, but they don't know how these symptoms develop. What comes first, the fever or the cough, or the temperature, the body temperature, how high the fever should be? And when that's when the person who is affected can get alerted. So I really want to ask Colin if he can let us know about it. That would be really helpful for.
Colin, you want to jump in with the observations and responses?
Okay, so the data so far says the majority of people have a fever and a dry cough. Okay, this is not counting the asymptomatic people. The problem is, like even here in Europe, my sister and my brother-in-law, we think have had COVID-19, and they recovered and they're fine, right? But we don't know because we can't get tested. So no one knows if they've had it unless they've actually had a test that tells them they've had it. And the test here, so it's just coming out, and I can tell you it's about £250 for a test if you do it privately, right? And the healthcare system here won't test you. It won't test you. If so you can say, I think I've had it, I think I'm now safe, I think I can go back into society, but they just don't have enough tests globally. So, going back to your question, Shailesh, you don't know. You just don't know. And, even if you think you've got the symptoms, you're not 100% sure that it is actually COVID-19. And you don't know if you're asymptomatic. So you might have it and show absolutely no symptoms and still be infecting people. So, and I think, Indians are not alone in this. The whole world is confronting this uncertainty. And until we have enough tests and we're able to say with any certainty, because you've had a medical test and they've said, look, you're free of this, or you've had it, you can't really make any assumptions.
Can I also just say that this is also a time to, like you said earlier, in terms of business viability and why it's important for news organizations to take note of it. I think also this is also a time to push for best media practices, because a lot of freelancers, like Shailesh said, apart from not having a press card, there's no news gathering expense ever given to freelancers to even go and afford like a private vehicle or a taxi to go somewhere and report. So a lot of times, a lot of these precautions that journalists are supposed to, take care of or have all the equipments, it also depends on them having to spend a lot of money to take care of themselves and protect themselves. And that, in the kind of media practices that exist right now in India, it's extremely difficult to spend that kind of money from your own pocket, especially as a freelancer, when you're paid per assignment, to actually follow it. So then it becomes all the more difficult. So this is also a time to push for it, because otherwise most of the freelancers do take public transport. There is not enough money. So yeah, that is something.
I would absolutely agree with that, because I think, look, if news organizations are asking people to take risks, not just with their lives, but with their lives of their loved ones, you need to give them backing. Right? You need to give them expenses at least paid. You need to pay them a fair wage, and you need to give them some reassurance that if they fall sick, if they have to isolate for 14 days, how are they going to earn money? Right? And this is not a unique Indian problem. This is the problem we've confronted here in newsrooms in the UK, where freelancers, in some of them, in their contracts, they don't get sick pay. And they're saying, well, why would I go out, potentially come home and infect my mother and kill her, and you won't even pay my sick pay?
Yeah. We don't even have contracts here most of the time. So
yeah. So look, I think the onus is on the journalists themselves to, I'm not saying go on strike, but really make your voices heard to the owners of the news industries. It's for those young journalists who are saying, oh, we're going to push the boat and make a name for ourselves, to realize they're part of a fraternity of other journalists. And it's really a time to stand together, because we do have to report this story, but we also have a commitment to our families and our loved ones to not get them into trouble because our egos are taking the forefront, right? And you're not alone. I mean, I'm desperate to go cover this story. I'm so jealous of my younger colleagues who don't have families who are out there reporting, and I'm stuck at home because I've got a six-week-old baby, right? But obviously, what do I say if I come home and infect my 6-week-old baby? What do I say to myself, right? So these are dilemmas we need to have internally with ourselves and also in the office, and we need to talk about it. And hopefully we get a better deal for journalists worldwide, not just in India and the UK and wherever. Sorry, I'm going to get off my soapbox now.
I think one very good tip that Colin did give us, and this is something that we've also been thinking at Newslaundry, is when you're assessing a story, when you're sending out a reporter, know how important that story is. I mean, is it really worth putting someone at risks? So even, for example, going to slums, we had a story that Neha Yadav, she's a freelance journalist, but she did it for us. She wanted to report on migrant laborers in Bhilwara, which is a district that first went into lockdown. And now you have migrant workers there, daily wage workers who don't have food. And they're literally, they're talking about how they just have like $700 or $600 to survive. So that's an important story to tell. And she did it, but she did it by speaking to people on the phone. And, she spoke to one person and she got numbers from the other person. So she spoke to about 15 workers. We got the story and we recorded the audio so that, the audience has a feel of who she's speaking to. We got all the details without sending her to Bhilwara and putting her at risk in a place which is locked down and potentially has a lot of COVID positive patients. And I think that really, that's something great with multimedia and internet. It allows us to be creative right now, the way we're doing this webinar. It allows us to record voices. It allows us to take pictures, make sketches, make a podcast out of something, and still tell the story without putting ourselves at risk. I think a lot of journalists, these are challenging times, but it also pushes us to be creative with our storytelling. So I think that's something.
Yeah, so just to add to Manisha's point, it is also very important for editors to assess the story and talk to the reporter that how much the story's part can be done without even going to the field.
Yeah.
And even if you need something from the ground, there is a great cooperation among most of the journalists, and especially the photojournalists, the way they have been operating, right? They have been helping each other because they cannot be everywhere, right? Similarly, we can always ask for help for the inputs that, from this location, I need this input, and people can help each other. That is what I think all of us have to start doing when we have to report certain things, what the government is hiding or trying to hide. So that is one thing. And the second thing is, as publishers, I personally feel that we should stop emphasizing more on pictures, on the things that need people to go on ground or in the hotbed. So I have stopped asking for pictures from my reporters because I know that people can't go there, and even if they are going there, they are putting themselves in this risk.
Yeah, information sharing. Great time for news organizations to come together and share information and put out a pool of, tap into each other's resources. And I think it's a good time for us to let go of that old-fashioned sense of my exclusive or my story.
Yeah.
Some stories I think we should all just come together and work on them together and put out information with the help.
I would like to chip in a bit here.
Yeah.
In Manipur, what we have done, we have got an union. It's called the All Manipur Working Journalists Union. So we are here for the welfare of the journalist. So what we have done, we have taken a decision on March 18th that we have closed down our press club because all the major press conferences in the state of Manipur are held at Manipur Press Club. So in order to protect the journalists, the union has taken a decision to shut down the union hall where the conferences are being held. And instead, we give a phone number or of a WhatsApp group of the reporters where the people who wants to make a statement or the civil organizations, they can come and share their grievances or post their any press releases on that particular phone number or through WhatsApp. And to the government, we have got the DIPR here. So the Chief Minister is sending out his audio tapes on WhatsApp, which we are also very comfortable with. And this is how we are sharing information right now in Manipur. The All Manipur Working Journalists Union has formed a group where all the houses are there. So we are forming a pool where each of us, whatever inputs we get, we're just giving on a sharing basis, but not the scoop.
Sorry, just to pick up on that. So in Italy, at the press conferences, only one journalist is allowed to go to the press conference. And so what they're doing is they're pooling the questions, and that journalist represents the whole journalistic fraternity.
Yeah.
And they're working together in that way, right? So I think that's the only way you're going to get to the truth. And obviously the Italian government is under a lot of pressure from its media right now. So I think, a bit of competition has to disappear in this time, because there's no other way of getting to the story.
That's a great idea. Great. So I think we should wrap this. Does anybody want to jump in? Anything that you'd want to, before I end?
We all need to take care of the public and the safety of our fellow journalists also.
That's a great note to end on. Thank you so much, Colin. Thanks a lot. That was very insightful, and I hope it gets us thinking.
Please do send us
and reporters.
Please do send us the points.
I'll send it to you right now.
Yeah. We'll also put this up on
everyone in office and scare them.
Yeah, definitely. And I'll send you a picture of that test swab. That should scare your reporter a little bit. And and we'll also be putting this up so you can share the video. And thank you so much, everyone, for taking out the time in this busy Corona season. And thanks a lot, Colin and David, for this. It was great.
No, pleasure. And, please reach out to us if you need any assistance or, you need any clarification on the points. I know what we're asking is difficult and doesn't come naturally. But, I hope everyone stays healthy and nothing happens to anyone in India, because we've already started losing journalistic colleagues elsewhere in the world to this disease.
Thank you.
Thank you.
Oh, thank you so much.
Thank you so much. Thank you.
Bye.
Bye.
Bye-bye.